Hi, Dr. Jim Augustine. I am happy to be talking to you about FDIC in 2023, likely the first year in 4 years that we've fully gotten to come back together to talk about issues relevant to the fire service. An important time in April of 2023 for us to be coming together, talking about better ways to serve our community. At FDIC in April, we are going to be talking about an EMS program. We're going to be talking about community paramedicine and building a sustainable program. I was part of one of those programs. I helped design it in Washington, D.C., a program called Street Calls. And it was related to programs that were going on across the country being developed at the time. Why in the fire service are we talking about community paramedicine? Well, that's how we serve our communities, and that's how we solve problems in the fire service. We are called upon by our community to serve the needs of people who have a variety of kind of clinical and behavioral and social needs in the community. When all else fails, who do they call? 911. And who gets dispatched? The fire service. It is for fire alarms. It's for CO alarms. It's for lift assist calls. It's for people locked out of their cars. It is for people that can't find their medicines. It's for people who can't get their mail, etc. And many of you know these calls. Why would the fire service be setting up programs to deal with these? Because this impacts how we overall serve our community. And by the way, all of these calls that we go to for our familiar face people, familiar address people, we get accustomed to the building and to dealing with them. Boy, does that come in handy when there's a real emergency and the building's on fire. More importantly, sustainable community paramedicine programs are the way we reduce the need for emergency services long-term. And that is most important to us in the fire service. I'm going to talk for 2 hours and listen to you talk about the nation's ability to develop these sustainable community paramedicine programs. I want all of you to attend and hear about the successful programs across the country. What are the next challenges in us designing these programs? And how do we make them so that they are both sustainable for us, we as members of the department who want to go out and serve our community, we have to be able to do that and have money to do that and have people that want to do that. By the way, the people that get into these programs just love them. It is so much more fun to go and prevent an emergency than to try to go and respond to one that's totally out of hand by the time that you get there. So sustaining community paramedicine programs in the community, Street Calls, look for it at FDIC April 2023. I look forward to seeing you.